One of these medications averages about 14 to 15% weight loss. The other can exceed 20%, and most people have no idea why. Hi, I'm Dr. Hart. I'm an OB-GYN physician, a medical director, owner, and injector at HartMD Medspa. And today I'm explaining the real difference between semaglutide and tirzepatide without the hype and without misinformation. This is for educational purposes only and not for personal medical advice. These medications are often grouped together, but they're not the same drug. They're related, but the biology matters. Semaglutide is the medication found in Ozempic, Wegovy, and there's an oral tablet that most don't know, but it's called Rybelsus. Semaglutide is manufactured by Novo Nordisk. Tirzepatide is the medication found in Mounjaro and Zepbound. Tirzepatide is manufactured by Eli Lilly. They have different companies, they are different molecules, and they have different mechanisms of action. Both medications are injectable peptides. They're engineered versions of natural hormones produced in our gut, and they are designed to last about 1 week in our body. Here is the key difference. Semaglutide works through one primary pathway. It activates the GLP1 receptor. GLP1 is a gut hormone that reduces appetite, it increases fullness, and it slows your stomach emptying. It also improves insulin response. That is why people feel full faster and they think about food less. We call it the food noise. Tirzepatide activates two pathways, not just one. It works on both the GLP1 receptor and the GIP receptor. GIP is another gut hormone that's involved in how the body processes nutrients and energy. This dual hormone signaling is one reason tirzepatide often produces greater average weight loss. Now let's talk numbers. In large clinical trials, people taking semaglutide lost an average of about 14 to 15% of their body weight over approximately 68 weeks. In similar trials, people taking tirzepatide lost between 15 and 21% of their body weight, depending on the dose, over about 72 weeks. In a direct head-to-head study, tirzepatide produced around 20% average weight loss, while semaglutide produced around 13 to 14% over the same time frame. That does not mean tirzepatide is right for everyone. Effectiveness is not just about the numbers. It also depends on the side effects, the tolerability, the access, cost, and whether they can stay on the medications long term. Both medications have similar side effects. The most common side effects that I see include nausea, vomiting, diarrhea, constipation, bloating, and acid reflux. These effects are usually dose related and most noticeable during dose increases. In clinical practice, how slowly the doses increase often matters more than which medication is chosen. In real world studies, people taking tirzepatide are more likely to reach 5, 10, and 15% weight loss compared to semaglutide. However, real life, it's not a clinical trial. The bottom line is this. Semaglutide targets one pathway, tirzepatide targets two. That difference, it matters scientifically and clinically. But the best medication, guys, is the one that you can tolerate, that you can stay consistent with, and use under proper medical supervision. If you want a follow-up video on how to reduce nausea, constipation, and plateaus on GLP-1 medications, let me know in the comments, guys. I'd be happy to make one. Again, I'm Dr. Hart, OB-GYN physician, medical director, owner, and injector at HartMD Medspa. Thanks for watching. See you guys soon. Tangled up in wires, I can't catch my breath. I run. Falling deeper, I can't